Today, we're going to speak to you about communicating with patients or clients who know more than they can say. This education is for paramedics, and we'll talk about supported conversation techniques for people with aphasia, SCA, and other communication disorders. The presenters are Vivian Epstein, speech-language pathologist, and Susan Harper, speech-language pathologist. And this training information has been adapted from the Aphasia Institute. Module 1, Introduction to Aphasia. Our overview for Module 1 is to discuss aphasia, understanding aphasia, communication accessibility, the rationale for supported conversation for adults with aphasia, SCA, and the aphasia experience. Understanding aphasia. Imagine if the last sentence you speak tonight is the last full sentence for the rest of your life. Stephen Goff, person with aphasia. What is aphasia? Aphasia is a disorder of the use of language. That is in the way we express or comprehend ideas through words. Aphasia results from a stroke, a brain injury, or brain illness, and it usually involves the left side of the brain. For most people, the language centers of the brain are on the left side of the brain. Aphasia may affect comprehension or expression of language, comprehension, understanding language, and expression, speaking, and getting the information out. When this happens, it can result in a communication disorder. And that communication disorder is aphasia. People with aphasia can have difficulty with any or all areas of language. This can include speaking, understanding, reading, and writing. However, it is important to note that all people with aphasia are still intelligent. They know what they want. They are competent adults, and they can make their own decisions. As the Aphasia Institute says, people with aphasia know more than they can say. As you can imagine, aphasia masks a person's competence and ability to communicate. A lot of people with aphasia feel that they are stupid because they're not able to get their message out. They know what they want to say, and they just have trouble expressing it. And people who don't understand aphasia may assume that the person with aphasia is not competent or is unintelligent. So it really takes skill for the conversation partner, you, to communicate with a person who has difficulty understanding or speaking. This education provides you, the conversation partner, with the skills to communicate in a meaningful way and to optimize the person's ability to communicate, to acknowledge the person's competence and to reveal their competence. Using these skills increases the ability of the paramedic to gather information needed to optimize patient care. For people with aphasia, it can be hard to initiate conversation and to initiate the use of communication strategies. So it becomes our responsibility, the conversation partner, to offer the needed supports, such as writing down choices, showing pictures, simple drawings, and using written resources, maps, a communication book. A lot of people with aphasia have communication books, so you could ask the person, can you show me?
Aphasia statistics. 1 in 3 stroke survivors have aphasia. Approximately 165,000 people in Canada are living with aphasia. Only 5% of the population in Ontario has basic knowledge of aphasia. And aphasia has been reported to most negatively impact quality of life, followed by Alzheimer's disease and cancer in long-term care. According to the Canadian Best Practice Guidelines for Stroke Care, developed in 2019, or updated in 2019, it addresses the impact of aphasia on the individual. Presence of post-stroke aphasia is associated with longer hospital stay, poorer outcomes in terms of activities of daily living, negative impact on social outcomes, increased risk for mortality, and negative impact on mood and quality of life.
Accessibility. How to make communication accessible. Just as physical accessibility is a legal requirement under AODA, Accessibility for Ontarians of Disabilities Act, so is communication accessibility. How to make communication accessible. Communication environments should be modified to adjust to the communication disabilities. Just as a person who has a physical disability would need a way to get into a building, such as a ramp or an elevator, a person with communication difficulty needs a communication ramp, a way to be able to participate in daily life. This ramp is supported conversation for adults with aphasia. A communication difficulty can cause communication barriers. Some barriers could be an untrained conversation partner, access to written information, such as consent forms, information about medical conditions, signage, and directions. Usually this kind of information is very difficult for anybody to read. Can you imagine what it's like for a person who has a communication difficulty? And people with communication difficulties can be excluded from decision-making due to their difficulties.
Why supported conversation for adults with aphasia? Why are we learning about these strategies today? Going back to Canadian best practice guidelines for stroke care, it's recommended there should be training for all healthcare professionals about aphasia and its impact. Optimizing healthcare conversations through supported conversation techniques for communication partners is acknowledged as important. All information for use with clients with aphasia should be available in what we can call aphasia-friendly format, adapted to the language abilities of that individual. Good communication practices improve healthcare outcomes, and this is highly relevant to our audience today. We know that talk is one of the main ingredients in the delivery of healthcare. The technical aspect of medicine depends on being able to talk to the affected person. For example, giving instructions, no food or drink before the medical test. This could be easily misunderstood for a person with a language difficulty or with aphasia. And that person may have not understood that the before component of that sentence, and as a result, there might be an error in the actual delivery of that test. Aphasia can affect all areas of language, including, of course, speaking, understanding, reading, and writing. That, as a result of that, aphasia is an excellent template for learning about all forms of communication disorders. So we talk today about aphasia, but we know that what we learned today to understand how to optimize communicating with a person with aphasia can also provide us with the skills for a person with ALS or Lou Gehrig's disease who is unable to speak, a person with Parkinson's or multiple sclerosis, hearing impairment, cerebral palsy, and of course in Canada, we're proud to say with all the non-English speakers that we provide these skills to also encourage the ability to communicate with those for whom English is a second language. We need a way to communicate with a person who knows more than they are able to say. For example, you may be the only person with that patient. And we all know the patient or people in general prefer to communicate directly rather than having others speak for them.